wash my hands, knock on the door, provide privacy. Hi, my name is Nelly. I'm going to be your nurse for the day. Can you state your name and date of birth? Okay, yep, that's you. Do I have consent to do this exam? Yes, okay, thank you. So before I begin, do you have any new skin issues, any headaches or neck pain? No? Okay. So I'm just going to inspect the skin on your face. I don't see any skin discoloration, unusual pigmentation, lesions, scars, wounds, or edema. And I'm going to inspect your upper and lower extremities. Skin matches ethnicity, no edema, no lesions, no scars, wounds, and same for the lower extremities. And now I'm going to palpate the skin of your face. I'm going to palpate your upper extremities and your lower extremities. And I'm going to check for cap refill, which is under 2 seconds on both fingers and on toes. And skin is warm and dry. And I'm also going to assess for skin turgor on your forearm. I don't see any tenting. Okay, I'm also going to inspect your nails for clubbing and pitting discoloration. I don't see any clubbing or pitting discoloration. Now I'm going to inspect your head. When inspecting your hair, I would have gloves on, but my patient doesn't have hair. And if my patient had hair distribution and hair is evenly distributed. I'm going to inspect your face, and I see facial symmetry, and I also see a normal cephalic head. So now I'm going to palpate the 7 spots on your head for any masses, tenderness, lesions, or hematomas. I don't feel any masses, tenderness, don't see any lesions or any hematomas. Now I'm going to palpate the temporomandibular joint. And can you open your mouth? Close your mouth. Open. Close. There's no clicks, tenderness, or crepitus in the temporomandibular joint. Now I'm going to palpate your frontal and maxillary sinuses for tenderness. Your frontal and maxillary. Do you have any tenderness when I palpate those areas? No, okay, I don't feel any tenderness either. Now I'm going to inspect your neck and trachea for placement. Can you stand up straight? Thanks. I don't see any lumps or bumps in the neck and trachea. Now I'm going to palpate your neck for pain, muscle tone, and thyroid enlargement. So I'm going to palpate the preauricular, the postauricular, the tonsillar, the submandibular, the submental, the occipital, the anterior cervical, the posterior cervical, the supraclavicular and the infraclavicular. Do you have any pain or tenderness when I palpate those areas? No, okay, no pain, no tenderness, no thyroid enlargement, and lymph nodes are non-palpable. Thank you, Mr. Smith, for allowing me to do this exam on you. Your doctor will be in with you soon.